Hi, my name is Kate Johansen, and I'm the Manager of Health Policy at the Minnesota Chamber of Commerce. The Minnesota Chamber of Commerce has long supported the legislative creation of a state health insurance exchange, and we were eager to see that Senate File 1, authored by Senator Tony Laurie, and House File 5, authored by Representative Joe Atkins, were dropped earlier this January as some of the most important legislation for the 2013 session. However, the Chamber does not support these bills in its current form. Indeed, the Chamber has a different vision than these bills currently show for what a health insurance exchange that works best for Minnesota consumers should look like. First, Minnesota is on a really quick timeline with how to build its exchange. This legislation has to go through several committees, in fact, a record number of committees by March 23rd. So in essence, we're doing the most important piece of legislation in half of the legislative session. That's a pretty tight timeline. First, Minnesota, we should walk before we run. And that means that doing only what is minimally required to comply with the ACA. This bill overreaches a little bit. Second, we think that a bill that is right for Minnesota should be one that does not cost small businesses more money. Currently, this bill finances a Minnesota exchange by imposing a 3.5% premium taxes on small businesses that already have to pay too much for health insurance through other costly regulatory assessments. Third, this bill creates a 7-person governance structure that wouldn't work well for Minnesota consumers. It wouldn't have people with the experience necessary to have the best board for a Minnesota exchange. And fourth, this bill allows a 7-person board to decide which products you have access to as consumers. That doesn't work for Minnesota business, and it won't work for you. At the end of the day, the Chamber is still supportive of building a Minnesota State Health Insurance Exchange, but we urge you to contact your legislators and let them know that you do not want an exchange that makes your insurance more expensive or takes away the plans that you have come to know and that you already know meet your needs and resources. Please tell your legislators and your other elected public officials that you want a pro-business and pro-consumer exchange, one that works for you and one that works for Minnesota.